Hello and welcome to Procedural Pain Management at the Patewood Memorial Hospital of the Greenville Hospital System. My name is Dr. Thomas Jarecky. I'm an anesthesiologist with a special interest in interventional pain management. And if you've been referred to our facility today, you're probably undergoing a lumbar epidural steroid injection for treatment of your low back and possibly even leg pain. And I wanted to spend a few minutes today explaining some of the anatomy and some of the reasons that we do epidural steroid injections as a treatment modality for this type pain. So let me start with some of the basics of the anatomy of the lumbar spine in the low back. If you kind of direct your attention over here, I have a model of the low back. And one of the first things you see are the discs in between the vertebral bodies. This is bone, these are discs. And as you may or may not know, the discs are like jelly donuts. They have a hard, fibrous outer part that we can see here, but in the center is a soft, gelatinous type material. And this is a great design. It can withstand tremendous axial loads, but for a variety of reasons, we can also have leakage of some of the central part of the disc through a little crack between the bone above and the disc below that can irritate the nerve roots at the tip of my pointer here. All the yellow structures you see are nerve roots. The nerve roots, particularly in the lowest part of the back, come out to approximately right here, where they blend together, forming the sciatic nerve, which is responsible for sensation and motor strength to the lower extremity. The nerve roots slightly higher up come out to about right here. They form the femoral nerve, which is responsible for sensation and motor strength in the front part of the leg, the hip, and the groin area. So depending on which level is irritating will dictate the type of symptoms that you're experiencing. There's many other causes for low back pain. It's a big topic, but for our discussions today, I want to focus on inflammation and irritation of the nerve root. The epidural steroid injection is designed specifically so that we can place a powerful anti-inflammatory medication called betamethasone in the area of the inflamed nerve root and some of the other structures in the low back. The epidural space is generally accessed via two different directions. We can do a midline approach, and we're looking at the back part of the spine, and this is where the skin is. And if you feel along the midline of your spine, a lot of people can actually feel these structures called spinous processes. And what we do after we do a prep of the skin and clean the skin is to place some local anesthetic in the skin. It's usually very well tolerated. We actually take a needle, we place a needle through the skin with the tip of the needle into the epidural space. Once we've confirmed placement in the epidural space, we then place our syringe on the needle and inject our active ingredient, in this case, the betamethasone, and we'll get a spread in approximately an area this big. Oftentimes, the disc herniation or the pathology in the spine is limited to one level of the spine on one side affecting one nerve root. In that instance, we will actually take our needle, come off the midline, actually direct it towards the nerve root that we're interested in, once again into the epidural space. We confirm our needle placement and then inject our active ingredient to surround the specific nerve root we're interested in. That procedure is called a transforaminal epidural steroid injection. The midline injection we call a translaminar epidural steroid injection. So let me walk you through a typical visit to our clinic and tell you what to expect before, during, and after your visit. When you come to Patewood Memorial Hospital, you walk in the front door, you'll be checked in the lobby. We'll bring you back to our pre-procedure area where I have everybody wash their hands, and we'll get you in a gown, and I'll spend a few minutes asking you if you have any questions. If you've watched our video, then I hope that will have covered a lot of it, but if you have any questions or doubts, we can certainly discuss them at that time. After we've had a little discussion, we'll take you back to the procedure area. We'll position our fluoroscopy, our C-arm, which allows us to watch the advancement of the needle. We'll do a sterile prep and drape of your skin, and then we'll actually place some local anesthetic in your skin. It's usually very well tolerated by most people. At that point, I'll actually place the epidural needle. When I'm confident that the tip of the needle's in the epidural space, our betamethasone is injected. The needle's removed. We make copies of the final picture of the injection. I'll give you one for your scrapbook at home if you so desire. We'll take you back to the recovery area, check your vital signs, make sure you're doing well. We'll give you some instructions to follow when you get home. The basics of those are essentially to rest for approximately 36 to 48 hours. Utilizing ice and heat treatments on your back, and we'll explain those to you in detail before you leave. So I'd like to thank you very much for taking your time to watch our video, and once again we'd look forward to seeing you and taking care of you at Procedural Pain Management. Thank you.